A person's smile. It's one of the first things many of us notice when meeting someone. Our smile plays an important part in how we look and feel about ourselves. So important that millions of Americans get braces every year to achieve that beautiful smile. But many don't realize that having straight teeth also plays a major factor in overall health and well-being.
Well, we're finding that dentistry and proper facial function, correct orientation of the teeth and the swallow, has a much larger role in overall health than people had assumed years ago. This is because of the new information about the interaction of the nervous system related to the jaw. Breathing at night, sleep apnea, seems to be strongly related to facial function. Behavioral problems are related to adequate tongue space and speech and hearing. These are things that have been discovered just recently and have really broadened the scope of dentistry as it relates to medicine.
While the medical community has only recently recognized the significant role dentistry has in overall health, many dentists realized this truth years ago. Based on this idea and developed with the input of medical doctors, osteopathic physicians, and chiropractors, a new treatment appliance called Alternative Light Wire Functionals, or ALF, was designed to not only realign the teeth, but also correct distortions in three main regions.
The three main purposes of the ALF are, first, to bring the cranial bones into good functional motion, balance motion. The second is to develop the dental arches to align the teeth, align the way the jaws function together with enough room for the tongue. And third, it's to bring those together and integrate them into a proper function, which would include swallowing, speech, and deglutition.
Some feel that by rectifying these three areas, the orthodontic appliance can help relieve chronic pain and remedy some common physical ailments.
What we found with the ALF is not only did it help align the teeth and make more room for the jaw and the tongue, but it brought a balance to the cranial bone motion, and it brought the tongue into a neutral swallow position, and that seems to bring the patient into an autonomic nervous system balance. And at that point, a number of other symptoms seemed to go away that were seemingly unrelated, whether they're heart problems or jaw problems, headaches, behavioral problems, all seem to disappear.
Well, patients come in with a whole variety of symptoms. With the ALF appliance, that has resolved many symptoms that were unable to be resolved in other ways. There was an 8-year-old boy who came to the office and he was unable to hear out of his left ear, 75% hearing loss, and he was also diagnosed with ADHD. And within 24 hours of placement of the ALF appliance, he was able to hear well, and at this time, his ADHD is resolved.
Although the dental treatment approach has been widely accepted within the field of dentistry, there is still the challenge of ensuring practitioners have a thorough understanding of how the appliance works.
Well, there's a whole variety of symptoms that are related to facial dysfunction that most practitioners don't know about. And so if a practitioner knows how to diagnose facial dysfunction and treat it, other symptoms that have been unresolvable in other ways can actually be resolved.
Researchers have discovered there is a strong link between oral and overall health. Renowned dentist Dr. Nordstrom has developed a major breakthrough aesthetic appliance that merges the fields of dentistry, medicine, and osteopathy.
The ALF is made of a very light orthodontic wire with 3 omega loops to make it springy. It fits in the mouth right at the gum line where people can barely notice it's there.
According to Dr. Nordstrom, the ALF appliance has been shown to produce life-changing results for patients worldwide.
The ALF has produced some pretty miraculous results. I can think of one patient that was recently in, and she had been given up on by one of the world's major teaching hospitals, and came in, and with osteopathy and the ALF, she was able to regain her weight and her function, going from not eating and going down to 85 pounds up to normal eating and a full professional life as an artist.
The ALF appliance can dramatically change the way physicians and dentists are practicing. I use it as a tool. As an osteopathic physician, I see a variety of patients with all kinds of symptoms including autonomic dysfunctions, pain syndromes, sleep issues, behavioral issues, and the ALF appliance has dramatically improved the quality of life in these patients. Physicians and dentists need to get training in how to use the ALF appliance and how to diagnose this facial dysfunction.
Dental experts advise patients that have been suffering from chronic pain or unusual health problems to seek ALF treatment.
The ALF device and philosophy offer hope where there was nothing before. It's completely opened up the worlds for our patients and for other patients that the doctors that work with me, and it can open up healing for other patients.
You don't need to live with pain. There is a solution, and the ALF appliance may be something that can help you.